Hey, how's it going, YouTube? So it's been a minute. Thought I'd do an update. I don't exactly remember what all I talked about the last time, so if it's doubled, it's double. But I had some other blood work done for a different doctor for something that doesn't relate to this. And so he pulled everything where I could get everything I needed. And so I was coming off the potassium. And so I was supposed to get blood work again. They cut my dose in half. And so I had to get that like 2 weeks. And so I got all the blood work done at one time. It is, everybody could use the same because all the information's there. Different doctors want different parts of it. So anyways, that's what I did. No problem. Local lab, happy to see me. They know us by now. And so I gave up my blood. And haven't heard back from the other doctor. But I heard from one of the biological manufacturers, so there's that. So I assume stuff's going through. He told me 2 to 4 weeks to get me changed over, yada yada. So not life-threatening. But so I got the blood work, like I said. So my gastrologist, LVN, wanted to pull a MELD score again in May. And that's when they're going to schedule for a abdominal scan again. It's easy peasy, local, still done. And so I already had all the numbers. So if you remember, my MELD score has been staying at 10, which is great. And it hasn't gone up, hasn't gone down. Until this blood work. And so the normal progression is always going to go up. And the longer you can maintain low score, obviously, the better off you are. And the longer you push out having to have a transplant, which is good. I'm going to have to go get my dog, and I didn't use my stinking pause cam. 1 second here. Come on, Sophie. Come on. Okay, I knew that was going to happen. But anyways, so I got the blood test, and like I said, obviously by now I know how to read. I know how to read all of it. And so I was like, well, hell, there's my MELD score again. You just have to use the calculator, and there's actually an app for it. So you just plug in some of the results in the app, and it tells you. So mine went down. And it went down to 9. And that's really good. And usually they don't go down. Not normally. But not to say they can't go down. But it's not the norm. It's progressive, and it should in its progression obviously get worse up until forced transplant or death. So I pulled those numbers. That's great news. And I stopped the potassium. Okay, the potassium test is in there. And I had the lab send all the results to my primary care. And I do that on purpose because it's in this big network. The Sutter, whatever. It's a big network. And so my information's in there, my portal, and they scan it in. And I don't have to do anything. And so that way, That way the doctors that need it can have it. And occasionally I'll send a random blood test like to my gastro. It's because I already had it. Let her look at it, and they do. And so everything worked out, I think. Oh yeah, so potassium level still perfect, still perfect. And so I've already been off of it. It was 2 weeks exactly, pretty much 2 weeks, give or take a day, but whatever. And so the doctor hasn't contacted me yet, but I'm sure he will. If not, I'll send him a message through the portal and say, yo, your potassium test is there. What do you want me to do? Which I'm pretty confident what he would tell me. And so I've already done it. I don't take it no more. And so I also ran out of this bolus of vitamin D on Sundays, 50,000 unit bolus of. And so that was a prescription left over from my old PCP. And maybe I'd have to trace it, but I don't know. Maybe back to when I was in ICU. I don't know. But for some reason, it wasn't in my portal. I don't know. We don't know why not, because we go to my appointments with a list of exactly what I'm taking, yada yada. And just to make sure the records are still matched up. And that way, like my important doctors, which I guess you could call them all that, but my gastrologist mainly. And so I texted them in the portal and said, hey, gonna get this to get it refilled. And they're like, hey, we don't know what you're talking about. What's this vitamin D, 50,000 units? And so I didn't respond. And the message I got was, well, the doctor's probably not going to refill this, yada, yada. And so the wife came home. I'm like, hey, it's just a bunch of yada, yada. And so let's just see what happens. I'll just stop taking that one too. And I have. And I don't know, nothing as bad has happened. But I guess if nothing else, I'll talk to my PCP when I see him. I don't know, it's a couple months, 3 months maybe. I think it's 6 months out, so probably, I don't know, 3, 4, probably 4 months. Anyways, I'll probably just tell them then, but that's where it's at. So everything's going good. I feel fine. I'm eating. I kind of started watching what I was eating, so because my weight just kept creeping up, and it went over 190, and it was like, holy heck, and I had to buy some fat pants. You can't just Walmart it every day. I've been Walmarting it for like a year, but so I had to get some fat pants. And I'm maintaining my weight just like 189, right around there. So I guess that'll be all right. It stays below 190. And because it's just fat, and that's all it is now, it's fat. And like I said, I've been eating good. I eat like a steak of pig now. And I sometimes I just get hungry like all day long, hungry. But so that's pretty much where I'm at. Still haven't shaved. Still haven't cut my hair. My plan was to try to make it all year. We'll see. I think I've gotten past the worst of what I can't stand. We'll see. Maybe, maybe not. And see what happens there. And I don't think a whole lot really. Oh, but the joint pain that hasn't gone away. So I'll probably send them a text in their portal. They respond like instantly. I swear someone's just sitting there waiting to answer my question. But I'll probably send them a message and see if they want to, if they can increase this, or if they want to change it up to something else. And we'll see. I think tramadol's on the list too to try, but I've only tried the one, the pregabalin. And it did stop my restless leg, and I started sleeping through the night. And so there's that. That was a huge relief. Sleep through the night, 6 hours, 5 hours. Once in a while, 7 hours. But it has helped, but not to my liking. Hopefully we can find something to make it work a little better. But that's the least of my complaints, so it's really not worth bitching about, Really, it's not. If that's my only bitch. So there's that. So yeah, no complaints. Got off 2 more meds. And April 12th, I'll have a recheck of the old upper GI. And I will see my gastro on that day. She always talks to me before they give me the funny juice and make me sleep. And when she's done, she usually talks to my wife as I'm waking up. It only takes a few minutes to wake up. So I'll at least touch base with her, and she can see me physically, yada yada. So that's the way that's going to work because of their patient load. I think I probably said it. They had another big gastrologist outfit that is no longer anymore. I don't know what happened, but they took on all their patients. So, but I don't expect anything negative on the upper GI. I'd kind of be shocked if there was an issue. Any issue, she just takes care of when she's got the tube crammed down my gullet. And but like I said, I don't expect anything. But that's it, Out in May. I don't have a schedule yet for that, but they'll call at some point in time and schedule me for the abdominal. Get to see my old friend, the Billy scanner. Really nice lady, really nice. But that's my update, Just kicking it. So when I left ICU, they said 180 days or less. That's 6 months. And it's been, I got an app for how long I live, believe it or not. And so it's been 454 days now since they've told me that. And here I am. Over a year. Kind of seems like it went fast for me, but it does now anyways, but it probably didn't back then. But yeah, 454 days. They could take their 180 and, it's just like, don't give me that crap. So good news, I guess, my MELD score went down. It can't go all the way down because the damage can't heal. That's done. But everything's working fine. The old kidneys and liver functions. So I guess I'm pretty lucky. I really don't know. But I'll be out of here. Check in again. I don't know when. Hopefully we don't have to do a whole lot in April. I know the wife still got some issues and has to go back to the female doctor, and odds are from the test results probably just do a hysterectomy on her and be done with it. But she doesn't have cancer or anything like that, but it's just something that happens to women bits, you know. She's all right, but she complains a lot about back pain. I don't know if that's from her work or what, but have to wait and see. I don't think she goes to the doctor till the end of the month almost. And that's local right here too, so that's most helpful. Last month, you know, we had to make 2 trips to, you know, inland, and they start to get spendy, you know. Gas there back, and of course I usually stop at Abby's. Last time we did stop at Abby's. I think I might have already said something, but no, I don't think I have. But we stopped at another place here on the coast that we like to eat. It's up north, but the route we take, we come right into it. And so we stopped and had dinner there for a change of pace. Uh, the old lady was getting tired of Abby's pizza, so we had to break it up. I don't think I'd ever get tired of their pizza, but that's just me and how much I like it. So I don't know, maybe we'll change it up again in April. I don't know. I have to hunt around. I don't know. I'm not a huge social type person, you know, but gotta give a little, you know. So maybe I'll try to find something. I don't know what. Maybe Indian food. I don't know. We'll see. So that's my update. And I'll just keep cruising for now. And I'm slow to complain about the joint pain. I know I said something before, but I still haven't contacted them. I get kind of leery, you know. It's like, take me off of it, and then I'm up all night because my legs are like jumping beans, you know. So that's the reason I just don't want it to happen. The same reason I'm on those diuretics, which they'd like me to come off of them. And they just like to taper it off to see. But the only way to find out is if I fill up with ascites again. And I don't want to get drained here. So I haven't come down. But as long as my kidney functions are good, I can stay on the dose. And those doses are really low. They're just a starting dose. They could really increase it a lot. But they don't need to. I don't need to be sitting in the bathroom just peeing all day long and night. And so everything's balanced there. And, my last appointment after the blood work from time before, the PCP, I think I saw him in February. February, must have been February, maybe January. But you know, he's like all the functions are great, or not great, but you know they're improving. This is what he said, you know, and just left me at it. You know, I'm like improving. What exactly does that mean? And I didn't ask him, but I talked about it. You know, with the wife. I was like, you know, you remember what he said about my blood work? You know, he's like, it's improving. What's that mean? Well, then I pulled the MELD score and it went down a point. So I guess that's what he meant. I don't know. But that's where I'm at. Monsoon season over here at the beach. More than normal, I think, but just day after day after day of rain. So don't come over to the beach anytime soon. Spring is not here yet. So I'm gonna bounce out of here, and I'll catch you guys soon. I'll update if anything changes. And I really, hopefully nothing changes, so the update will be boring. And they're kind of boring now. It's just like autopilot, and occasionally I kick out a pill. I don't take it no more. But life's good. You guys be healthy. Advocate for your own health. Find doctors that work with you, not against you. Don't be afraid to fire your doctors. And don't let anybody ever tell you you can't find more information on Google than what your doctor knows. Because I guarantee you can. And some doctors that'll piss off. And some will absorb the information and work with you. So, best thing is stay healthy. Till next time, peace out, guys.